Welcome to our series on debunking myths of mental illness. So today's topic is OCD, which stands for Obsessive-compulsive Disorder. And the myth today is that all people with OCD have to line things up, count, and wash their hands excessively. So I'd like to debunk this by telling you that OCD is a much broader problem than just those three things. People can have obsessions, which are recurring thoughts that cause a lot of anxiety, with or without compulsions. And compulsions are behaviors that people do in order to make them feel less anxious. They can also have compulsions without necessarily having an obsession that goes with it. I also want you to know that kids can have OCD, adults can have OCD, people in the geriatric community can have OCD, so it's a pretty far-reaching problem. So I just wanted to give you a little bit broader of a feel of what OCD is in case you're feeling confused about your own behavior or thoughts or those of somebody else. So I have seen people who have OCD around being afraid that they're going to vomit or somebody else's, and so they will do all sorts of things to try to avoid that. I have had people who have recurring thoughts of hurting themselves or somebody else, and they'll do anything to make that stop. I've had people who worry that something bad is going to happen to a family member or a loved one, so they believe that if they touch everything in their bedroom before they go to sleep at night, that nothing bad will happen. One of the hallmarks of OCD is that there often isn't a real connection between the thing that people do to make themselves feel better and the actual thing they're trying to prevent. So clearly, if you are a child or an adult who thinks a loved one might get into a car accident, touching everything in your bedroom or, I don't know, jumping up and down 6 times is probably not actually going to have an impact on the safety of your loved one, but you almost can convince yourself because that's how your brain's working at that time. It sort of disengages from reality a little bit. So people have recurring thoughts about sexuality, about religion. It's really anytime you just can't control your mind at all and it's causing anxiety and you're engaging in some kind of behavior to control the anxiety. So that's our myth for the day. If you are a loved one, and we have some other information on our website that can open the door so that you can have a little bit more understanding about OCD. So if your loved one is experiencing this and you need some help understanding what's going on and getting some treatment, we'd be happy to help. We have a great program for kids who have OCD. We have one that's computer-based and one that uses a really fun workbook. It's called What to Do When Your Brain Gets Stuck. And then we use this fun, engaging DVD program called Camp Cope-A-Lot. So those are great fun to do, and it's amazing how much better people can get in a very short amount of time. You can reach us online at ricepsychology.com. We have a website, we have a social media presence. If you need to reach us, please give us a call, send us an email. That, of course, is confidential. And again, OCD is a pretty broad problem, and we want you to debunk the myths surrounding it. So thanks for coming. We'll see you next time.